This conference will now be recorded.
All right. Okay, so today we've tried a couple of times to do this over the last month, this particular version, and we haven't had a lot of people sign up, so we've sort of truncated it, or in one case, not done it at all. So today I'm going to do the full presentation on advocacy. Now, there's two types of advocacy in this presentation. There's advocacy for individuals on their behalf. So, as a provider of service, you can advocate for the people you serve. You can also be advocating for your own livelihood as well. So if you work in this field and want to continue to work in this field, it may be in your best interest to advocate for positions that will bring more money, keep the money we have, do what's necessary to really make it so that we can provide the best level of service that we possibly can. The other type of advocacy that we'll be talking about today will be advocacy for that we're teaching the people that we are providing services for so that they can become self advocates. Um, in the past, I have gone up to Sacramento, and I've also gone to Washington, D.C., and done some advocacy work. And one of the things that I found was that when I'm going up there and advocating, they look at it as that's very nice. You work in this field. You have a vested interest in wanting to make sure that services continue. But when I go with someone who is receiving services, and they share their story about how this system, how the provider of residential services, how the day activity or the vocational services they've received, the therapies they've received, have been so helpful in making it so that they can lead a more typical, normal life that isn't revolving around disability, but is revolving around their abilities, um, that has a much more poignant effect on people, and they really can see how the dollars and how the commitment that they make to our service delivery system really pays off, and how it affects their constituents, the people that are in their district back home, how they're affected by the votes and the decisions that they make in their situation. Also, advocacy can be on a local level, so that if you're looking at services through the Kern Regional Center, through Department of Rehabilitation, through the Kern County Behavioral Health, Social Security Administration, other resources, education. How do you go about advocating to get individuals the services that they need from other agencies, and either assisting them with the advocacy process or teaching them how to self advocate for their own benefit? Okay, so first of all, if you are wanting continuing education credit for today's presentation, which will be 1 hour, you must attend the entire webinar. You must identify yourself. So I see you're on the screen here, so we know who you are. If there's more than one person in the room with you, each person has to identify themselves at the beginning of this presentation so we know that there are multiple people that are going to be asking for credit. You need to send the your a three um, items of what you learned today. Can be brief, can be bullet points, one, two, three, uh, to Irene at Bakersfield ARC. The web address is on there within 1 month, and she will then send you a certificate of for the 1 hour credit. And moving on, another way you can receive CEUs is through a self-directed program that Bakersfield ARC has available. So as part of this grant, Bakersfield ARC contracted with Relias, which is a very large national company that does accreditation and continuing education, not accreditation, but continuing education in a number of areas for many different fields. So they do mental health, they do developmental disabilities, they do employment related issues. They're a multifaceted company that focuses on continuing education. So we contracted with them. We went through their catalog. We found 31 particular courses that are relevant to what we're doing in home and community based waiver. So if you want to get additional continuing education credits and or you want to train some of your staff so that who can't be on this hour call in areas that might be important to the work that they do, you can use this Relias training. The advantage to this is if you contact the Bakersfield ARC, and that's either Valerie or Irene, they can give you a passcode. You get in the first time, then you create your unique uh, password, and you can take up to the 31 courses. And these courses are self directed. So you decide when you want to get on the course. So if you at 8 o'clock in the evening after dinner and the dishes and everybody's sort of off doing their thing, you want to spend an hour or two doing that, you can. If you don't finish it up, you can come back later, a day to a week later, and finish it up. Once you finish up a course, you can take a test, and if you get 80% or greater on the test, you receive credit and you get a certificate. And if you work with Valerie and Irene, we'll make sure that the certificate that you receive is applicable to your continuing education needs for both Kern Regional Center and for community care licensing if you're a licensed program. So
And
that
then
is
just really
available.
quick, sorry, just really quick, Jeff, they do have to take that little exit survey. And as soon as that exit survey, it's a few questions, it'll generate their certificate, just for clarification on a few of those.
Okay, good. So that is out there and available. Then on we're going to be having some national experts coming out to California. Originally, we had planned on doing this back in January and February, but we had some challenges with that based off of the fact that the new rate model that DDS is doing sort of was taking all of Kern Regional Center's time for the most part, and they asked us to postpone this training. So now the training is scheduled for July and August. This training is predominantly related to employment issues. So for those of you who work in a adult day type service, so that you're providing community-based activities, training, etc. This would be a good course to take for you. And we're going to have one track that's specifically for persons who work in that field. And they're going to be half-day classes that you would take over 2 days. And so the fact that we have 3 days in here is because we're having different groups on different days, and all that will be coming out very shortly. So we'll have one track that is for day services, and another track that will be specifically for vocational providers. So those folks that are doing supported employment, paid internships, competitive employment, that'll be a separate track than the ones that are more the day activity and social skills type programming. And that's coming up in July. Two national, one person's from Wisconsin, the other person is from Massachusetts. So not only are we getting top level experts, but we're also getting people who have a slightly different perspective. They're not California perspective. So that helps, I find, that knowing what other states, what other folks are doing throughout the country adds to the array of services that we can provide here. So I strongly encourage you, if you the signups will be coming out shortly, and the sign up for that, and we're looking to try to maximize participation. You can bring more than one person from your program. So if you want to bring 2, 3 folks from your program, that's permissible of this. Okay, now we're getting into the topic. Advocacy on an individual or system level is acting with or on behalf of an individual or group to resolve an issue. So, on an individual level, let's say that you have someone who is going to your program, and the regional center says, "Oh well, we don't feel that this program is really in your best interest anymore, and we'd like you to switch to this other program." And the individual says, "No, I want to continue to go here." And they ask you as a provider to, "Hey, can you help me in appealing the regional center's decision on what they're going to do? They're going to cut back on the number of hours I can go every week. They really would like me to go to a different type of program. They want me to get into a vocational service rather than a day service, etc." So that would be individual advocacy. Systems advocacy, and we're going to talk about this a little bit later, is when you're talking about a larger issue that has to do with how funding is, how programs are decided upon. You know, right now we're really working on a number of issues here at the state level. There is the continual implementation of the new rate model, and with that new model, there have been some things that people have discovered that are creating some challenges. So in the area of like Taylor Day, transportation, some other areas, there's some negotiation going on to see if we can maybe get a different calculation on some of the rates and things. And plus, there's a number of other areas that are being looked at. And we're going to talk about a couple of pieces of legislation that are out there right now. So if somebody needs services or supports, we can help advocate for them, or they teach them to advocate for themselves, so that if a individual who's in your program comes to you and say, "Hey, listen, I would like to get into a social recreation program in the evenings and on weekends, and can you help me with my service coordinator to get that put into my plan so I can get those additional services that I think that I would really enjoy and would be very helpful for my independence." Promoting a change in practice, policy, or behaviors of a third party. So maybe we want to see things done differently. Maybe we want to, an example would be the regional center has policies specific to what services they purchase, how they purchase those services, etc. And those are online. You can take a look at those. And if you look at one of those and say, "Wait a minute, this isn't a good thing," or "I think this could be done better. I think that," this is limiting, and I don't think it's consistent with what the Lanterman Act really says we should be doing for services. You can advocate for that. So you can advocate for that one client or that one individual who needs that change, or you can advocate for the system and say, "Wait a minute, regional center, you need to go back, and I would like to see you rewrite these and really take a look at these, and see, and if a rewrite is necessary to do that, take it to your board, get approval for a change in that standard." Advocacy is essential for promoting and protecting the civil and human rights of people with intellectual and developmental disabilities, and to establish and maintain or improve the quality of their lives. So that's that's what advocacy is all about. We're trying to help the people that we serve. But in addition to that as well, sometimes the advocacy is to promote the services that we provide, and we want to make them better, or we want to continue them, or we feel that there needs to be some changes in the way we do things. We can advocate for that as well. Without strong advocacy at all levels, people with intellectual and or developmental disabilities may not have the needed supports, as well as the opportunity to exercise inherent civil and human rights. Now, historically, much of the advocacy was done by people in the system. So we were doing a lot of the advocacy for folks. Um, in the last 30 years, more and more of that advocacy has been done by the individuals themselves with training and with expertise and help. Much more of the training is done by people with the disabilities themselves and trying to really talk with legislators, community leaders, regional center, area boards, state DD councils, a number of the Department of Developmental Services to really try to get their perspective into the equation. Additionally, strong advocacy may be required to prevent or address abuse, neglect, or exploitation that people with intellectual or developmental disabilities may be experiencing. So if you find as a provider that somebody comes to you and shares with you something that's occurring maybe within their home, maybe within their neighborhood, something in their life which shouldn't be occurring, that's it could be abuse, neglect, exploitation, you are a mandated reporter, but also you want to be an advocate to really assist that person through the process of getting that changed, getting that eliminated, and moving on to a more positive situation for that person. Persons with intellectual and developmental disabilities may need the support of advocates to become effective self-advocates. So we're out there trying to teach people to advocate for themselves. Um, the goal of system advocacy is to enhance public awareness of the rights, strengths, needs, and interests of people with developmental disabilities and influence laws and policies to improve public private systems and support services. So what we're trying to do is we're trying to support folks. We're trying to make sure and make the community aware. Why is it important and why is it valuable that persons with developmental and intellectual and developmental disabilities are part of our community? 40, 50 years ago, most individuals were sort of behind the fences at state-run institutions. And we made a policy shift and decided that people should be part of the community and be treated the same respect and dignity that all other citizens in the community are. And that came about by advocacy back then, throughout time, and currently. So what we're really trying to do is to make sure that the rights, strengths, needs, and interests of the people that we work with are maintained, protected, ensured. Service providers and self-advocates should play a meaningful role in systems change. Agencies providing supports to individuals should also advocate for systems change that improve the quality of the life of individual, whether supported by that agency or not. So if you're really working on supporting individuals, you should be supporting individuals even if they're not part of your service. So if I'm the XYZ day program and I see something that needs to be changed at the regional center, and this may not be affecting only the clients at XYZ day, it may also be applied to individuals at other day programs, individuals who are, in work settings, etc. I should be advocating for the whole system and not just for the interests of the people I serve or my agency. So, and these are position statements that were made by the National ARC, which is an advocacy organization that is based in Washington, D.C., and locally in Bakersfield. The Bakersfield ARC is a member, a chapter of the National ARC. If you haven't been on their website, if you go to the ARC, there's all kinds of information on advocacy, on issues, on positions that they've taken, and they can oftentimes, some of that information can assist you if you are looking at doing advocacy work on behalf of your individuals. People with intellectual and developmental disabilities have the right to advocate and to be supported to act as self-advocates. So we want to make sure that the people that we're serving know that they can speak up, and they can speak up and speak up in a way that their voice is heard and respected, and there is no retaliation. Okay, you spoke up, so that's going to affect the amount of services you're going to get. We're going to take it out on you. No, can't do that. People should be free to advocate for their best interests or for the system, and we should be teaching that, respecting that, encouraging that, doing whatever we can to support the individuals that we serve to speak up for themselves and for other individuals that are part of our system, and also to be citizens in general. So that includes voting and being involved with civil matters. Like, for example, tomorrow there is going to be a rally here in Bakersfield related to some of the issues on the national level on the budget and on Medicaid. And, a number of advocates are planning on being there. Some are probably going to speak up on their own behalf, as well as, some folks who are involved with the system. So there's going to be a fairly good sized rally here in Bakersfield tomorrow. Self advocates exercise their rights as citizens by communicating for and representing themselves and others with whatever support they need. So sometimes people need support to advocate for themselves. So, for example, if somebody isn't sure how to approach a legislator, maybe you can help them with that, or provide assistance in the meeting, or maybe helping that person with translation if that's something that they have some difficulty with, and making sure that their voice is heard. Self-advocates must have a meaningful role in decision making in all areas of their daily lives and in public policy decisions that affect people with IDD. And this starts out with, on an individual basis, with the IPP. So as we're working with individuals and developing their individual plan, that's where advocacy starts. Okay, so what do you want? What services and supports would be helpful for you to accomplish the goals that you would like for your life? And in teaching people to do that, that's the first step towards greater advocacy. 40 years ago, when I first started out in the system, we had a model where we would make all the decisions. So we, meaning the service coordinator, back then we called them psychiatric social workers, but we would make the decisions about people's lives. So that I would go into the meeting and we would sit down with the providers of services, and we talk about what services they provided for that individual over the last year, what services that they're looking forward to providing for the following year. And we would then decide and say, okay, so these are the services that you're going to receive. And we didn't necessarily say to the person, is this what you want? Or are there other things that you would like instead? Or in addition to, that wasn't necessarily part of the equation. It's like, okay, here we have an individual, they need a program during a day. Here's the program during a day that we've identified. Here you go. And so now we say, no, we want people to be able to make meaningful decisions and to decide what they want and how they want their program. The old cliche that we sometimes talked about back in the old days is it was almost like the tail wagging the dog. So the provider was making decisions about that person's life rather than the person making decisions about what provider and what services they were receiving. So there's different types of advocacy. There's political, so that if you're talking about an issue that's going on in Sacramento, in Washington, D.C., that's one type of advocacy. There's service advocacy. So you're talking about, okay, what services am I receiving? And I would like to have more services or different services or more or a change in the way those services are being delivered. So that's a type of advocacy. And then finally, funding. This system runs on a budget, and we in California have a very generous uh, developmental services system. Not necessarily that case in all states. So, maintaining that level of funding is a continual challenge, both here in California and nationally. We want to advocate for that because if those funds don't flow, then our ability to provide some of the services and supports that we do for the people that we serve would be greatly affected. As I've mentioned in some of these webinars before, a number of states have waiting lists so that people who come into the system and go to in the front door of the state developmental services system, and most states have something uh, that is publicly funded. California is sort of unique with its private nonprofit regional centers, but in many states, you knock on the door and you get put on a waiting list. And as people either leave the state, close their case, pass on, uh, then a slot opens and the next person on the waiting list moves into that position to get services and support. So funding is a major concern. It continues to be a major concern, and we're going to talk about that a little bit later, specific to what's going on in Washington right now. Individuals of IDD and service providers need resources that educate and empower them to bring about change. And there are a number of different services and resources that are out there that can help you. The State Developmental Disability Council, here in California, has some good information on self-advocacy. The Disability Rights California has materials related to self-advocacy. ARC, as I mentioned, has advocacy material. And so does Disability Rights California. So there are about 4 or 5 different sources that I can just think of off the top of my head where you can get materials specifically to helping people with their advocacy. People with IDD, their service providers need support to successfully navigate the system. So this is where these tools come in handy, where you can get support. So if you are going to help a client or an individual advocate, knowing what you're going to do so that when you go into that meeting with the service coordinator, if you're going into an appeal, if you're going to visit a legislator's office or another agency, you have a good idea of how the process works and what you're going to be talking about and who you're going to be meeting with and what they potentially can or cannot do. So that helps you. Individuals who need support should have the access to the necessary education and assistance. So getting those materials that are out there and that you can download them from these different agencies is very helpful to this process. Individuals should not be retaliated against for their advocacy. And again, important point, a few years ago, I was made aware of an individual who spoke up to their coordinator about something that was happening with staff in the facility that they were living in. And the next time the coordinator came out to see that individual said, "You got me in some big trouble." And the coordinator said, "How's that?" And they said, "Well, I told you that this stuff was going on, and you made an issue with the administrator of the facility, and who then wrote up the staff, and the staff came back and basically took it out on me. And you can't have that. If an individual makes a statement or brings to your attention or to someone else's attention their advocacy, that has to be respected, and there cannot be any retaliation. Kern Regional Center has a very specific whistleblower policy, which is for both your staff, for you, and for the individuals that we serve. so that if someone is indeed bringing forth a challenge to the status quo or is not happy with something, that needs to be done without the fear of retribution, retaliation, etc. Now, some of the things that are out there, laws, and that really uh, give the individuals that we serve their rights both at the national and the state level, are the Americans with Disabilities Act, the Rehabilitation Act, the Individuals with Disabilities Education Act, and the Lanterman Act. So the first three are federal laws, the fourth one being a California law. And what these do is they really spell out in legislation and then subsequently the regulations that have been generated to implement this legislation, what is the rights of individuals with disabilities. They include things like reasonable accommodations, the right to services, the right to be to a public education that's free and appropriate. And then in California, we have the Lanterman Act, which says that sets a standard for community that all individuals with IDD can aspire to and to achieve. So when you're assisting someone with advocacy or teaching them to do it themselves, these are oftentimes good things to go back to and take a look at, because they can give you like a foundation for which to base the challenges or concerns that you have. So, for example, if the regional center just blanketly says, "Oh, we don't buy that," that's no, it's not. That's not a service we provide. Um, you can ask, or the individual can ask, "Well, okay, show me in the law, in the Lanterman Act, where it says I can't have this," and then the regional center has to then provide you with where their decision making came about. So is that based off of there is a law that says that you need to use other resources before you use regional center resources, and therefore they don't buy it because there's another resource that can pay for that, or whether it's just something that that particular regional center has decided is a policy that they as a center adhere to, but isn't necessarily consistent with the laws or regulation. The laws and regulations may be silent. They may not actually address that issue, but so the regional center sort of decided on it, and you may want to challenge their decision on that. And there's a whole process that you can do to do that. And again, that's where getting that information from the different resources, or from Disability Rights California, the area boards, the State DD Council, the ARC can really help in setting the groundwork for before you go on with your appeals process. Some of the services that potentially you want to look at that may need the individual may need assistance in self-advocacy, or that you can help them with. Healthcare is a biggie. That there's a lot of research that shows that people with disabilities don't get the same level of healthcare that other individuals with private insurance, with who are neurotypical receive. So sometimes going in with that individual to the appointment and helping them articulate what their concerns are is a type of advocacy. It's having them speak up themselves to share with their healthcare provider what their needs are is self-advocacy. You sharing concerns that the individual has shared with you or that you've seen can also be advocacy in that situation. Employment and education, the individuals that we serve make up far less uh, employed individuals than does the general population. So, if we're advocating for people to be in the workforce, and California, a number of years ago, passed a law saying that for young adults coming out of public education, we should really be looking at employment first before we look at programming during the day. We want to make sure that you get people into the workforce. So, if we want to be advocating for individuals to be part of employment, or sometimes post-secondary education too. So we have adults who decide that they want to go on to a community college or to the state college here in Bakersfield. We want to be helpful for them to navigate that process of how to do that. The one community college out in Taft has a whole curriculum and program that's including a independent living skills program to teach adults independence on a college campus. But they also offer classwork. Bakersfield College has a student support unit that is available for individuals who would like to go there and take classes and potentially get a degree. Support and services and support. So primarily these are a lot of times services from the regional center, but they can also be services from other agencies as well. So helping people to get the services that would be helpful for them. That a lot of times people don't necessarily know what's out there and don't ask for the services that they need. And sometimes you face a situation where you're dealing with a fairly new service coordinator and they don't necessarily know all of the services that are available to the individuals that they serve. They know what they've seen from the other individuals on their caseload that they visited. They know what some of their other colleagues have shared with them or their manager has shared with them, but they may not have an understanding of the full array of what's available out there. And so advocating for that. Housing assistance. This is a very large area. There's a program called Section 8 Housing, and that's run by the county of Kern in our area. It is they do have a program specifically for low income individuals, and there is a set aside where there's a certain number of units specifically for persons with disabilities. And so sometimes somebody walks into the Section 8 office and they're told, well, no, we have a waiting list. It's 3 to 5 years before you're would be considered. But we have a secondary program which is specifically for persons with disabilities, and that has some availability, or that has a much shorter waiting list than does the other program. And if you can get into Section 8 housing, that is basically where you pay 1/3 of your income. So if you're receiving public benefits, so SSI, you'd pay 1/3 of your SSI for your apartment, and the rest of the apartment would be paid for under the Section 8 voucher that you received. Community services. So you want to make sure that the individuals can utilize all the same services that anyone else does. So, going out to events in the community, going to parks and recreation, to senior centers, to other service centers through the YMCA, the other places that any other member of the community would partake in. We want to make sure that they advocate for our folks to make sure they can use as well. And then benefits. What we find sometimes is that individuals aren't receiving all the benefits that they can receive. They may be receiving Social Security, and clearly they're receiving regional center services, but are they eligible for other types of services? Can they get some food assistance, or some, like I said, rental assistance or utility assistance, or other types of benefits that may be out there that they might qualify for, and how do we go about trying to find out some of those benefits? There is a number of resources. The service coordinator can help with some of those. There is the 211 system where you can dial 211 if you have a specific concern or request, and they can help you to try to go through what resources are available. There's the Center for Independent Living here in town that can also help with certain things. So we want to try to advocate for as many services as we can. And again, for funding, benefits we mentioned, employment, day, and educational services. We want to make sure that the individual receives the services that they would like to receive in these areas, both as a child through education, to get that they're getting the education that they need through the Individual with Disabilities Education Act. At the national level right now, there is some changes that are going on. The new federal administration is moving a lot of the services out of the Department of Education and moving it into health services. And there are some advocates who are concerned about what that will mean for Individuals with Disabilities Education Act. At this point, we'll have to stay tuned and see how that shift really affects the ability of individuals who have concerns about the services that they're receiving in the education system and how those get resolved. Again, regional center services is the person receiving the services that they need, want, are appropriate for that individual, consistent with their individual person-centered planning. Housing assistance, as we mentioned earlier, sometimes people who are living independently and supported living or independent living and have their own apartment can get subsidies to assist them with the cost of their apartment, with the utilities, food assistance, etc. So we want to make sure that that individual is qualified for the different types of services. And then healthcare, to make sure that they are getting the healthcare that they need. And one of the things that I've oftentimes found over the years is that sometimes our individuals, especially who are on Medi-Cal services, aren't necessarily receiving all the preventive health care. So that as a male, the certain screenings as you age, prostate screenings or rectal screenings, other things for females, breast, colon, uterus, other types of screenings that are part of the aging process to make sure that we stay healthy throughout our adult life aren't always taking place. And also sometimes ability to receive other types of preventative health care needs to be assured. Okay, moving on. Okay. This is a potential advocacy in action. So here's an example. The House of Representatives and the Senate recently have passed budget blueprints with a cut to $880 billion in spending and this is in the House version, the House Energy and Commerce committees over the next 10 years. Now, this committee is responsible for Medicaid in California, Medi-Cal funding. And a significant portion of this committee's budget is Medicaid. And the House Republicans who are moving this through say, okay, we want to make these cuts, but we want to avoid cutting healthcare programs. Therefore, the scale of the reductions to Medicaid is unknown. And currently, it's not possible to estimate the level of cuts to California's Medicaid program. So we know that potential cuts may come, and if they do, what will those cuts be? And we hear different messages. We hear messages that no, we're looking at cutting fraud and abuse, and it shouldn't really affect people's health care. And other folks saying, no, you can't make that big of a cut without really getting down to the bone. The California Budget and Policy Center has estimated that the proposal currently at play in Congress could translate to an annual loss of 10 to 20 billion a year for California. The IDD community is concerned that cuts could shatter services, including healthcare, community living supports, and essential services. So you have different people saying different things about these potential cuts. And so what you end up with claims and counterclaims. So you have some people saying one thing, you have some people saying another thing. Okay, now the president has said, I'm not going to touch Social Security, Medicare, and Medicaid. We're going to get fraud out of there. Everybody wants to get fraud out. We're going to have a tremendous growth. Okay, Congress needs to take a hard look at all federal care programs to ensure tax dollars are spent wisely. Weeding out waste, fraud, and abuse could save billions and help safeguard these vital programs so that they're available for all now and then. And then the Speaker of the House on the Republican side says that savings could accomplish through eliminating Medicaid waste and fraud. And he cited about 50 billion in alleged fraud, a small slice of the GOP goal, according to the Washington Post. So 50 billion, when you're talking about 880 billion, is a big difference. So on the other side, you have the Congressional Budget Office, which is a nonpartisan office that doesn't take sides one way or the other. They just look at the issue and try to figure it out. Found that even if Energy and Commerce cuts every program except Medicaid, so they cut everything else, but not Medicaid, Medicare, and children's health care, they would be able to save only about 135 billion, far below the Republican stated $880 billion goal. So and Medicaid is an expensive program, and the potential extension of the current tax plan is also costly. So the Republicans are looking at continuing the tax break for persons of higher income. To keep both of these programs and the tax cuts, you have to find a way to limit benefits. And if it's not through cuts in funding, it would have to be through increased requirements. So the one side is saying, no, we think we can use fraud, get rid of fraud and abuse. The other side saying, even if you do that, there's not going to be enough of a cut. So you're going to end up having to limit benefits to people in the system. So how do you feel about this? This is an example of where you can be an advocate. The rally that's occurring tomorrow is more along this side, which says that, wait a minute, you're going to end up cutting the services, that the math just doesn't work. But we also have two local legislators, both Congressman Fong and Congressman Valadao, who said that they do not want to see cuts to their constituents in terms of health care. So how do we reconcile this? And how can you, as a provider and also someone who works with individuals, help explain this issue? Wait a minute, this is what's happening in Washington right now. There's different approaches to what's going on. One side says this is going to be catastrophic and is going to basically wreck the system as we know it. The other side saying, no, we think we can do this through just being smarter and cutting back on things. And there are some people in the middle who think, wait a minute, you're going to have to make some changes, but let's see how much of the system we can maintain. So do we advocate for leave it alone? Just, continue we have a system that isn't broken. You don't need to fix it. Did you have a system that says, okay, we need to make some cuts, but we need to be judicious about those and make sure that it's primarily fraud and abuse? Or do we have the other hand of we need to make major cuts to the system? And you, as individuals, as organizations, like, for example, the National ARC has come out very much in favor of that we need to advocate to maintain all the services that we currently have, as has a number of other IDD organizations. So just an example of what advocacy is all about. Um, Let me see here. Okay, here is on the state level a bill that's currently moving through the state legislature. And what this bill would allow for is for uh, persons who have um, seizure disorders and are going to licensed day programs, the ability for someone on the staff of the day program who's specifically trained in the area of administering this medication could administer a medication to the individual once they receive the training. And you can read the specifics of this legislation. It is Assembly Bill 1172. And when you, for your information, when a bill is introduced in the California legislature, and they have a similar situation in the at the federal level, the House in which it was introduced in, either the Assembly or the Senate, or in the House of Representatives or the Senate at the federal level, they get a letter designation that this is an Assembly bill. If it was SB, it would be a Senate bill, and then that's the number. So the bills as they get introduced are given are sequentially numbered, and so as they go through the process. So if you were to Google AB 1172 and put in this year, because there have been previous AB 1172 pieces of legislation, you could get a copy of this and read the specifics. So if you have individuals in your program who do have seizure disorders, who have had seizures in your program during the day, this piece of legislation might be something that you would want to take a look at and read the specifics and see if this is something that makes sense, and if there's something that maybe you would like to see changed, a little tweaked, or you support it, or support it if it's amended, or you think that this is not a good piece of legislation. You can contact your state assemblyman or assemblywoman and let them know that how your feelings on this particular piece of legislation. So that's a type of advocacy that you can do. You could also talk to the individuals who maybe have the seizure disorders, or their families, and have them really contact legislators and talk to them about this. Um, um, and then here's another bill that is in the California legislature right now, and this is a Senate Bill 422, and this would really change the way work is viewed by the public employees and retirement system, and it would support a workforce development program specifically to try to enhance work opportunities for people with developmental disabilities. So, and again, if you're interested in this, you can type it, Google SB 422 California, and it will give you the whole piece of legislation. And when you look at legislation online, what you also see is when it was first proposed, when it was put on the calendar for different committees, what's happened to the bill. Sometimes bills get changed, they get marked up, they get parts of it get eliminated, parts of it get added, and so as it goes through the process, there can be changes to the language. So if you're interested in any of these bills, I would encourage you to take a look at them. So these are just two examples of what's going on at the California level. So if you're going to meet with a legislator or a local official, or even somebody at the regional center, it's important that you sort of do a little prep work before you go in. Develop your message of what you want to say about the particular issue. What are you advocating for? Maybe come up with 3 or 4 bullet points. Decide what you want to ask for. Okay, so hey, if we're going in to talk to the coordinator about some changes that we want in Mary's plan, what are we going to want to? What are we going to want to ask her? If possible, bring supporting documents or material. So if you have something that would really help with what you're going to be addressing, that's always helpful. Focusing on developing talking points, and again, the bullet points that you want to, and not a wish, a list of what you want. So you what you need. And sometimes opportunities will present themselves that will make what you ask for very timely. And so it could be just the right time to ask for it. Now, if you're looking at talking with people who are higher up, so you're now going to talk with people who are in the state legislature, when they come back to the district, if you want to talk to one of our Congress persons, you need to be very succinct. You're not going to get a lot of time. They have a number of constituencies and a number of issues that they're attempting to address. And so when you get a meeting, it's going to be a quick meeting. And so you come in and you want to have you be ready, be focused, know what you're going to talk about, do that. And I think that's a good strategy with any advocacy work that you do when you're talking with other folks. Keep it short, keep it to the point, talk specifically about what the needs are, what needs to be changed, what you'd like to see for that individual, what the individual themselves would like to see. Go in with a laundry list, this big and this tall, and it's not, you're going to get cut off. And your effectiveness in terms of addressing issues will not happen. Okay, so check in the beginning of the meeting how long you have to present to ask. Okay, so we know your time is very valuable. So how long do you think we can talk with you? Adjust your presentation accordingly. So they tell you, well, I'm looking at my watch and I've got to be, I have to be across town in half an hour, so you can have 15 minutes. Keep your message clear, concise, and consistent as it relates to what you're asking for. Be assertive, not passive or aggressive. So you don't want to say, okay, whatever you say, or you don't want to get in their face and say, okay, I'm going to tell you what to do. You want to just say, this is what our issue is. So you're being assertive. You're speaking up. Don't go off topic. Don't go off onto something else that has nothing to do with why you've come into meeting. Again, time is of the essence. Finish with what you want from the meeting and how you want it done. So kind of summarize. So in conclusion, we came in here today to talk about this. These are the reasons why, and this is what we're hoping to achieve based off of our meeting today. And finish with what you want from the meeting and how you want it done. Okay. And then don't blindside. Don't at the last minute say, oh, and by the way, so, keep it to the point. Now for self-advocacy, you are the person first and not your disability. So if you're working with people who are advocating for themselves, you want to make sure that they understand, hey, you're a person. You have the same rights and same abilities and to get services as anyone else. You have the same opportunities and rights as other people. You want to work with others and yourself to take control of your lives. You want to be the main person who decides. You believe in dignity and independence of people with disabilities. You understand that people with disabilities can make their own decisions when given choices. So these are what you really want to stress. And advocacy should know about, understand, and assert their rights. So if you're a person who has IDD, you want to know that you have your rights. And those rights are available again, Disability Rights California, area boards, the State DD Council, all have rights. Many of the facilities have rights posted in the facilities. And those are basically rights specific to the facility, but there are also basic human rights that also pertain in the work that we do. Practice self-determination and advocacy. So sometimes it's helpful if you're going to be going into a meeting to help that individual rehearse what they're going to say and get a good message together so that it can be practical. Practice self-protection. So an advocate's part of what good advocacy is knowing how to protect yourself from abuse, neglect, exploitation. Obtain needed services, and fully participate in the community. So these are the goals that we're really trying to accomplish. Okay, and with that, it's now 11 o'clock. Any questions or concerns anybody wants to raise? Going once? Going twice. Okay, that concludes our session today. Again, if you want continuing education credits for this today's presentation, please contact Irene or Valerie with the 3 areas that you learned today, and you can get 1 hour credit. And hopefully we'll see you next Wednesday when we do another topic. Thank you and goodbye.
Thank you, Jeff.
Bye-bye.
Thank you, Jeff.